My name is Dr. Shahid. I'm a general pediatrician and medical educator. And in this video series, we've been talking about how to prevent burnout and how to develop resilience for doctors and medical students. Today's topic is going to focus on self-care strategies of nutrition, sleep, and exercise. So let's go ahead and get started. So this is my overview of wellness and resilience. I like to think of wellness and burnout on the opposite ends of the spectrum. And in order to prevent burnout, we have to promote wellness. And part of promoting wellness is developing resilience and doing other strategies to help prevent burnout and depression and suicide. The blue arrows going back and forth indicate that there's overlap in all these areas. So anything that develops resilience also prevents burnout, and anything that prevents burnout can help develop resilience. So in this video series, we've been talking about different resilience strategies and wellness strategies, and now we're focusing on self-care. So this is the component of the chart that we're going to be talking about today, about self-care. And specifically in this video today, we're going to be talking about nutrition, sleep, and exercise. In other videos, I talk about mindfulness and meditation and faith and spirituality. And then in another video, I talk about different relaxation techniques and deep breathing. So make sure you check out those videos as well. This one's going to focus on nutrition, sleep, and exercise. Unfortunately, these three things, as healthcare providers, as medical students, as residents, as practicing physicians, and overall healthcare providers, these three things we sacrifice the most when it comes to our nutrition and healthy eating, when it comes to our sleep, when it comes to exercise and physical activity. We don't do enough of this, or we don't pay enough attention to these areas. And unfortunately, we sacrifice a lot of these things in our effort to be good healthcare providers. So we do have to focus on these aspects of self-care because they're very, very important. So I want to briefly touch upon each one of these three. So let's talk about nutrition first. So we know that maintaining an ideal body weight is essential for physical health and emotional health. So maintaining an ideal body weight, not being overweight, not being underweight, but can help you in your physical health and also can help you in your emotional health. And one of the basic principles is that we should always aim for 3 meals a day with 1 or 2 snacks per day. And that can allow for good, healthy nutrition. So we know that research suggests that there are different foods that can have a positive impact on your emotional health. So some of the foods that can positively affect your emotional health include eating fruits and vegetables, eating whole grains like brown rice and whole wheat flour or oatmeal or popcorn, eating legumes like beans and peas, chickpeas, lentils, soybeans, peanuts, eating other foods like avocados and olives, eating fish and seafood and other things that have omega-3 fatty acids, which includes the fish and the seafoods, but also things like nuts and seeds and plant oils. So all of these research suggests that these type of foods can have a positive effect on our emotional health. Research also suggests that there are some foods that can have a negative effect on our emotional health. And those include processed foods, anything that is frozen, anything that is in a can, anything that is kind of a ready to eat meal is a processed food, and that can have a negative effect on our emotional health. And then refined foods can also negatively affect our emotional health. So refined foods, some examples include white bread, white rice, pizza dough, breakfast cereals, bagels, cake. There's others, but these are just some common things that we eat. And then sweet items and sugary type of foods can also have a negative effect on our emotional health. So we have to pay attention to our nutrition because the things we eat can affect not only our physical health, but also our emotional health. And unfortunately, as medical students, as residents, as practicing physicians, our schedules, we're busy, we're on the run. And a lot of times we end up eating foods that are processed foods or refined foods or sugary foods, which is not good for our emotional health. So we have to keep that in mind because this is very hard for us to do. We're given our busy schedules and given our time constraints, and it's easy to grab some sort of processed food or refined food or sugary food just to kind of keep us going and keeping us helping us get us through the day. But we have to take a moment and think about what we are eating, what is our nutrition like, and try to eat more healthy because that definitely has an impact on our physical health, but also our emotional health. So something that we need to keep in mind as healthcare providers, as students, as residents, as practicing physicians, that nutrition is very, very important, and we can't sacrifice good, healthy nutrition in our daily schedule. So we must make time for that and keep that in mind then. Okay, so now let's move on to sleep. This quote is good. It says, "A good laugh and a long sleep are the two best cures for anything." I think this really highlights that a good night's sleep really has a positive effect on us, right? And this quote says it's a cure for anything, right? So I think we really underestimate the importance of a good night's sleep. We don't appreciate the role that sleep has in our overall health, in our physical health and our emotional health. And again, this is something that we don't keep in mind as healthcare providers, as medical students, as residents, as practicing physicians. This is another thing that we sacrifice is our sleep, given our schedules, given our crazy schedules, the day shift, the night shift, the 24-hour shift, the different things that we have to do. And unfortunately, sleep is something that gets sacrificed. And sometimes we can't control our schedules, but we have to keep this in mind. And whenever we have the opportunity, and our schedules allow, we should try to take advantage of a restful sleep and a good night's sleep, because that can really have a positive impact on our physical health and our emotional health. This quote reminds us that sleeping is like meditation. It's good to rest the body, but also to shut the mind down for a bit. And that's what happens when we sleep, right? Our mind shuts down for a bit, and we can kind of rest and relax, and we kind of recharge our mind and our brain and our bodies by getting a good night's sleep. So it's very important to keep that in mind. Unfortunately, with technology and with phones and tablets and constantly, always being connected, that affects our sleep. That affects our sleep hygiene. It's having a negative impact on our sleep, which is having an effect on our physical health and our emotional health. Because unfortunately, now we're connected all the time, right? So we're kind of connected to work all the time. We're connected to our friends and our family members all the time. And we need to learn to just kind of disconnect. We need to be able to just kind of log off. So we need to be able to kind of turn off or log off or disconnect and sleep. And the time of sleep is when we need to be doing that, because that time is when we recharge. So kind of like we recharge our phones, we have to recharge ourselves. We have to recharge our brains, recharge our minds, and turning off everything and allowing for a good night's sleep is a very important aspect of our overall physical health and overall our emotional health. So we need to learn to do this a little bit better. Is to turn off and log off and disconnect so we can get a good night's sleep. Like I mentioned, sleep allows us to recharge. Now our brain needs to recharge every night. So we should try to do that undisturbed. So we turn off our phone and put on silent or do something so that we're not woken up in the middle of the night and disturbed by our phone going off. So we need to give our time, we need to log off and disconnect and give time for our brain to recharge every single night. And we know when you don't get enough sleep and you have sleep deprivation, it could have a very negative effect on your overall physical health, emotional health, and your behaviors, right? We've all experienced children, right? When they get tired, they get really cranky, right? Or you may know of, or you may yourself be an adult that when you get tired and fatigued, you kind of become irritable or emotionally volatile. And we know from studies that healthcare providers who are drained and tired and fatigued, they provide less effective patient care, and they make more errors. That can affect the safety of patients. So sleep deprivation has a very detrimental effect on our performance, on our productivity, on our efficiency, on our effectiveness. So we have to keep that in mind. And unfortunately, again, this is so hard for us to do as healthcare providers. We are all at risk for sleep deprivation and probably are suffering from sleep deprivation because of our schedules, because of the movement of our shifts. So again, sometimes we can't do a whole lot about that, but maybe you can try to work out something about that. But if you can't, the days that you are able to get a good night's sleep, make sure you get a good night's sleep by turning off your phone and disconnecting, and trying to recharge on those nights when you don't have to be working or you're off and you're able to recharge that. So keep that in mind, and it's very important for our physical health and our emotional health. And again, we know that sleep deprivation causes mood swings. It causes increased irritability. It can predispose to anxiety and depression symptoms. It causes a loss of coping skills. It causes a reduced ability to concentrate and think critically. And then with sleep deprivation, you have a lower capacity to assimilate new information and to learn new things. So again, sleep deprivation can be a major problem. And again, especially healthcare providers, we are at risk of this, and that can affect our patient care. So how do we improve our sleep? We have to focus on and recognize the importance of sleep hygiene. So there's a few principles of sleep hygiene that are important to get a good night's sleep, right? So when you know you have a time to be able to sleep and you're not on call and you're not having to work, you turn off your phone and you get a good night's sleep. These are things that can help you overall in your sleep hygiene and have good restful sleep as well. So basically it's suggested that you should go to bed at the same time every day and try to wake up at the same time every day. If possible, again, have a routine where you go to bed and wake up at the same time of the day. We should try to aim for about 7 to 9 hours of sleep. So we should get at least a minimum of 7 hours of sleep every night. And again, there'll be some nights where you can't, but then you should try to do that on the nights that you can. You should try to limit naps because if you nap in the daytime, then you're going to be awake at nighttime. And you should only sleep only in the bedroom and not like on the couch or in a different room, right? So again, it's a matter of getting a routine and following that routine as much as possible. You should try to reduce light and bright stimuli 1 to 2 hours before bed. So all these things can really help you fall asleep and get a more restful type of sleep when you do fall asleep. Then. Other suggestions for sleep hygiene include avoid large meals and fluids in the evening for a couple hours before going to bed. Avoid exercising within 4 hours of going to bed. Limiting caffeine and tobacco and alcohol consumption 4 to 6 hours before going to bed. And avoid extreme temperatures before going to bed. So again, all these things can help you fall asleep and allow you to have a more restful type of sleep, because that's important too, is to get restful sleep. It's not just the amount of sleep, but it's also the quality of sleep. And all that is important. It's all part of sleep hygiene. Sometimes we have trouble falling asleep, right? We might suffer from various forms of insomnia, where it's an acute insomnia or more of a chronic insomnia, and there's different reasons for insomnia. Some are more related to our physical health, and some are related to our emotional health. So there might be some physical health conditions that are causing insomnia, like sleep apnea and obstructive sleep apnea, or maybe there's some illness that someone has that is causing them to have pain that prevents them from sleeping well, or there are different medications that can cause insomnia. So there's different physical health issues that can cause insomnia. Then there's emotional health issues that can cause insomnia. So when we're anxious or when we're stressed or when we start to feel depressed, that can cause us to have trouble falling asleep as well. So I think it's really important to identify what is the underlying reason for not being able to sleep. Why do you have insomnia? Is there some sort of physical health condition that needs to be identified and recognized and treated? Or is there some sort of emotional health condition that needs to be recognized and identified and treated? So it's important to try to identify the underlying reason for which you're having trouble sleeping. And once you identify that, getting the appropriate therapy for that and treatment for that can be very helpful. So I think that's an important aspect of sleep. And then there are many apps that are available to help you sleep as well. So these are some of the ones that are out there that I've heard people like and tend to use. So again, using some of these apps to help you fall asleep can be another way to help you as part of your sleep hygiene or as part of your routine. This can be helpful as well. But again, if you're having trouble sleeping, try to understand why you're having trouble sleeping. Is there some sort of physical health condition or emotional health condition that is causing you to have trouble sleeping, and try to identify it and treat the underlying cause if possible. Then. So again, sleep is very important aspect of our self-care, and this is again one of those parts of self-care that unfortunately medical students, residents, practicing physicians, we sacrifice this because we are busy with our schedules or because we are committed to caring for our patients. So this is one of the things that gets sacrificed along with our nutrition and healthy eating habits. Sleep is sacrificed as well, but I think it's important for us to take a moment and think about our habits when it comes to sleep and the importance of sleep, and try to understand that to improve our self-care, which will help our resilience and overall wellness and help prevent us from burning out. So now I want to move on to exercise. So there's the third thing we're going to talk about, and the last thing we're going to talk about. We talked about nutrition, and then we talked about sleep, and now we're going to talk about exercise. So we know that physical training can really help improve mood, cognition, and emotional resilience. So regular exercise and physical training can really help with our resilience and our emotional resilience. So it is so important. And again, unfortunately, this is one of the things that we end up sacrificing as healthcare providers, as medical students, as residents, as practicing physicians. We tend to sacrifice the exercise, and we don't have time for that. We're too tired for that. We just aren't interested in it. But again, this is a very important part of self-care, of resilience and protection against burnout. So we have to understand that, recognize that, and try to make time for exercise and regular exercise and physical training to help our emotional resilience. So there's many benefits of regular physical activity. That includes helping control your weight, which can then combat the different health conditions and diseases that are related to weight gain and obesity. Physical activity can improve your mood. It can boost your energy. It can promote better sleep. And if you do it in groups, it can be fun and it can allow you to socialize. So there's many benefits of regular physical activity. And again, all these things can add to our resilience, and we have to try to do regular physical activity to maintain our resilience. Aerobic exercise can help reduce symptoms of anxiety and depression. So again, the more exercise we do and the more aerobic exercise we do, that can really help reduce these type of symptoms of anxiety and depression, and could be a form of stress relief and stress management, and that can help prevent us from burning out. So we have to keep that in mind. So as far as how much exercise, so it's recommended for healthy adults between ages of 18 and 64 to do at least 150 minutes to 300 minutes of a week of moderate intensity exercise and activity. Or you could do more vigorous intensity activity, but then you should limit it to 75 minutes to 150 minutes per week. So this is what's recommended about how much exercise or physical activity should be done on a weekly basis. So we should spread it out over the week. And this is what we should try to shoot for. Now, this is just a general recommendation for healthy adults in this age range, but you should always talk to your doctor, talk to your physician about your exercise regimen and your exercise program. And it should be individualized for you and your weight and your health conditions and other medical issues that you may have. So these numbers might be altered and modified with the consult of your own physician. So make sure you talk to your doctor before taking on an exercise program and physical activity program. But this is general recommendations that are out there to help guide how much activity we should all be trying to do then. And then here's an example of different types of activities, moderate intensity activities, and then vigorous intensity activities that you can use to kind of help you decide what you might want to do. But again, make sure you talk to your doctor about what's best for you, what's the best form for you, and the amount and the time for you based on your own medical condition. So talk to your doctor before you take on an exercise regimen. And again, I think it's important to try different forms of exercise. For some people, one type of exercise is going to be helpful and they're into it. And for someone else, that's not going to work for them. So there's different forms of exercise that were listed on that previous slide. There's others out there as well. So try different forms of exercise and see what helps with you and what really works for you, and individualize it for you. And then you should develop a set of well-defined goals for your physical exercise regimen, right? And then work toward those goals. And when you achieve those goals, reward yourself when you meet those goals. And gradually, you should intensify your regimen. So start off kind of slow, take it easy, consult your doctor, and work your way up and intensify your regimen over time. And then it's important to find a support system to help you maintain a regular exercise regimen. So find some friends or family members who will support you, or you can exercise with and do the physical activity with, because that will be a source of motivation and support as well. There's various apps that are out there as well that can help you with your physical activity program, so you can use those as well. And I think it's very important to, again, notice the positive feelings as you are developing your exercise program and your physical activity regimen. You're going to feel better and positive when it comes to your physical health and your emotional health. And you should notice that, and you should feel that and recognize that, because that will give you more motivation to continue to exercise on a regular basis. So again, it's very important to make sure that we exercise as part of our self-care strategies to help develop resilience and prevent us from burning out. Okay, so again, these were the 3 areas that we talked about today in the self-care category: nutrition, sleep, and exercise. And again, these are very important aspects of self-care that we have to keep in mind. And unfortunately, medical students, residents, practicing physicians, healthcare providers, we're not very good at this part of self-care, especially because we're so busy, we're on the run, we don't have time for this, we don't think about it. but it's a very important aspect of our wellness that we have to keep in mind. So don't sacrifice healthy eating and nutritional eating, or your sleep, or your exercise. Try to minimize the sacrifice of that, and whenever you can. Obviously, there's moments and times where you can't, and you're going to have to sacrifice it a little bit. But when you are able to, try to eat more healthy, try to get the proper amount of sleep, and try to exercise on a regular basis, and build that into your self-care strategies, so that that can promote resilience and wellness, and help prevent the risk of burning out then. So with that, I want to thank you for watching this video. And like I said, there's other videos that are out there under other self-care strategies that I made. So make sure you check those out as well, and look forward to seeing you at those other videos as well.